easy to work with a doctor. For instance, I have students in urology, oncology, dermatology, psychiatry. They are all masters there. Here, except you have to think and misunderstand modern concept. Viparta sarvabhutana mada sarvapravitya. To sukam, the aim and objective of any system of things. Upasanthanam arogya, arogyasya bhava. So, I hope in the future, work together. Ayurvedic doctors also improve their clinical work to correct their mistakes, improve their modern clinical methods, not modern medicine methods of diagnosis, stop exaggerating the things, stop exaggerating the prognosis, accept the reality, accept the adverse effect if it happens. Because no system can be static. Okay, the system is static. Whether it is Ayurveda or allopathy, it is jnana. That's what Chiranjeev has said. Nahi jnanena sadrisham pavitra nidasti. Nothing is superior to. So here also, I as an individual maintain very good rapport with Western counterparts. Many areas, consultants come to our hospital, their opinion, we accept our limitations, diagnose, refer to diagnose, and allow them to. So, this type of accepting good things from every system of medicine, Ayurveda, Siddha, given its name, day by day, the demand for our service. Visit my place, you can see the infrastructure is very good. We do not have attractive buildings. We do not have sophisticated. We have students. They are like police officers. I cannot hide anything. Because infrastructure does not detect the caliber of a disease. That's the party decide to efficiency of Panjaram. So we got an opportunity to treat COVID patients of various stages, including complications. And there was a wonderful cardiologist nearby, a great kind-hearted person who gave us permission, like last year, to do a clinical trial on hypoxic conditions. We have seen many doctors presenting asymptomatic, mild to moderate cases.
and everybody has done a good job. It is not that I have done. Everybody has done a good job. Probably the style of treatment may be different. The medicine selected may be different. So what? They have healed and it produced results. So languages are many. Silence is one. There is no Japan silence or there is no Goku silence. So methodologies are many. Aim is to bring Arogya safe. We have seen our Rajabandi, Dr. Rajabandi, did an innovative work in doing Vamana, which needs appreciation from the heart. This is a unique approach and courageous approach started by him. Then we are started doing. And his courage is phenomenal. I remember when Swamiji came from Rishikesh with a tropical sprue. Rajabandi did Putapagam and did Pichavasti. I told him Balam Tasigi with Balam, he is very weak and all. He did not prove results. Like Muthunagai, my student in Chennai, is courageously treating, giving Pushkara Mula Mandal as Parsha Sulakna. Very committed clinician. So likewise, many, I told few names, many are there, many people. North India style is different. So we will enter into the topic. It's a very long session, very long session. I hope everybody will be there to see because it contains segment by segment by segment by segment. It take you mild cases, moderate cases, severe cases, allopathy alone, allopathy with Ayurveda, Ayurveda alone, complications, management of complications, incidental findings of different diseases while going to treat COVID. All these things are there. COVID-19, the second wave, and an Ayurvedic approach, conceptual study and a practical study. Challenges and treatment plans and experience through Ayurveda during the second wave of COVID-19. We didn't present earlier because it took such a long time for the study to be completed. Now we admit post-COVID stroke. Already 6 patients are there in the ward. Post-COVID stroke, thrombus, fatigue, post-viral headache, post-viral neuralgia, demyelinations. Everything we record, document, shoot. This is my grandfather. I owe my clinical existence to him. Vaidya Mahadev Iyer, who started this Vaidyasalaya 102 years before. 102 years before. It's a great clinician, great ultimate clinician. And this is my master who initiated me in the fundamentals of Ayurveda. In the year, I joined in 90 to 93. And this is the team, Dr. Danya was the co-investigator who worked in the ICU platform in the modern hospital. She is from our foundation. Dr. Ramjit, a BAMS student who is with me now, studying in my Gurukulam, who is from Panagajagasturi Ayurveda College, final year scholar. who also worked in the ICU with the modern doctor. Dr. Aishwarya, her contribution is remarkable. She is looking after my clinic in Chennai, direct disciple of myself. Did beautiful work. Dr. Jayalakshmi is with me for past 20 years. When I am not there, she sees the patient. Treated around few lakhs of cases independently. She is a clinical assistant, helped in the project, treating patients in Darsanango. So 2 were treating in modern hospital, one in Chennai, one in Darsanango. And of course, I am the I was coordinating the teamwork. Here you see Dr. Dhanyaraj and Ramjit with full setup in the ICU, taking rounds, monitoring the cases, helping them all the time, courageously, because at that time, fear was there. And I asked them who is going to work. They told they are ready. They were vaccinated. And we gave some immunomodulated medicines to boost their Agni and immunity. And they enjoyed, committed to the work. SARS-CoV-2, severe acute respiratory syndrome, coronavirus, has been mutating to give rise to variants that are more challenging and life-threatening in the second wave of COVID-19. The variant of second wave, coded as B1617, that has 5 mutations in the spike glycoprotein, shows increased infectivity, increased transmissibility, the quality of the disease or the trait being able to be passed from one person or organism to another. Sankramandi Naran Naren. Ability to evade host immune system. Lineage B1617 is a lineage of SARS-CoV-2, the virus that causes COVID-19. Has 3 sub-lineages according to the Pango nomenclature. B1617-1, Kappa variant, first detected in India in December 2020. 6172 Delta variant, discovered in late 2020. 6173 observed in January 2021. Diagnostic assessment, we have rapid antigen test in the containment zones only for mass testing, quick results. Reverse transcriptase, polymerase chain reaction, RT-PCR, primarily a process that repeatedly copies and amplifies the specific genetic fragments of the virus, ensuring that there is enough of sample to conduct the analysis. Testing process 4 to 8 hours. Result depend from lab to lab. TrueNAT, a chip-based test that works by detecting SARS-CoV-2 E gene and RT-RP gene, RNA-dependent RNA polymerase, quicker results within 30 minutes. CBNAT, Cambridge-based nucleic acid amplification test, which is reported to be quicker and costlier. These things were not available in Kanyakumari district. So in the cases we have admitted, the hypoxemia cases in the allopathic ward, and other cases, we did all of the investigations before and after. Complete blood count, erythrocyte sedimentation rate, C-reactive protein, LFT, RFT, D-dimer, LDH, electrolytes, ferritin, interleukin 6, CT chest. CT chest if there is worsening of the condition. MRI brain, orbit, PNS, rhinocerebral for mucormycosis with the CT chest. These were done in all the cases. MRI was repeated if there is a clinical need. We are going to see everything. Different aspects of treatment in COVID-19. One is preventive. A large part of the community, we gave preventive medicine, Swastha Samrakshanam. Treatment of management of COVID-19, the Pradhana Chikitsa, a lot of variants in that, mild, moderate, asymptomatic. 70% are asymptomatic. Remaining 30% only all the complications and the problems we face. Treatment of complications of COVID, Upadrava Chikitsa, various Upadravas. I am going to narrate that. Post-recovery treatment, Rasayanam and Roganam Abunarbhave. In Kerala, we have studied COVID has affected. Second time, somebody. Recently, I read in a newspaper. So the preventive measures, Agni, correction, prevention of ama formation, Ojas, in a broad sense of physical realities, includes immunoglobulins and plasma proteins, but it is much beyond that. Agni Divana Dravyas, Rasayana, Vishamaguna Virodhitva Dravyas, and yogas. So in that condition, we were giving completely asymptomatic Swastha Samrakshanam, Thirkadu and Shavanapras Legium and Aparajita Dhumam were given. If somebody is affected in the community, a nearby house, we started Pajanamradam or Barangyadi based on Pitta Pradhanya or Vada Pradhanya, Vada Kapha Pradhanya. Based on the Avastha Visesham, medicines were changed. Vikriti Parampara has to be considered, and you cannot say one medicine is effective and one medicine alone is effective. But while working in a modern setup, we had only the option of selecting a combination which we tried. That combination was a fixed combination. But in our center, but in the OPD, but treating the outpatients through online consultations, based on the Avastha, we changed the medicines. Of course, some of the medicines were standard. ICMR guidelines were followed. Mild upper respiratory tract infection with or without fever, without shortness of breath, saturation 93% to 95%. Moderate, any one of the respiratory rate greater than 24 per minute, breathlessness, oxygen saturation 90 to 93 on room air, severe respiratory rate greater than 30 per minute, breathlessness, oxygen less than 90 on room air. Mild presentation, Mridu, may or may not have fever. Only symptoms may include URI with or without hypoxia. Vigilant monitoring of temperature and SpO2 for 14 days from the time of first symptoms or testing. So we were giving Barangyadi, Thirukadu, Vishamada, mutation. Whenever there is Vishamada, Barangi is selected. Barangi is told in Vishamajjaram. Barangi is told in Tamakaswasam. Barangi is told in Penasam. Barangi is told in Raktagulmam. Barangi is told in Apaswaram, where the Lina Avastha is tackled. Alpogidosho, Dushyadiyalabdo, Anyadamopalam. Then Agastya Rasayanam in Vada Kapha Pradhanyam and Vada Pitta Pradhanyam Kushmandam, Aparajita Lubam, Legium. You should all remember that in Ashtanga Hridayam, in Jwara Chikitsa, Legium and Aristas are not mentioned. So in Jwaram, Legium is not given. So legium is always given when there is no jwara. Ashtanga Hridayam Jwara Prakaranam is whole and complete, but legium is not mentioned in the around 180 shlokas, but in later texts like Vaishajya Ratnavali, which contains everything. Swastha Samrakshanam, oxygen 19 to 93 at room air, respiratory rate 24 per minute. Common symptoms include without fever, cold, throat irritation, infection, anosmia, loss of taste, loss of appetite, headache, body ache, fatigue, peenasam, kasam, kantarodam, kapha pradhanya condition, patyakustumbradi, or vagradi, or abhyap vipali moladi, trikaduvadi, tali sabatradi churnam, vyoshadi vatakam, all are kadurasa, kaduvibaga, ushnavirya, kapavada shamana, srodo shodhana, in agni vardhana in nature. So for Kafanubandham, this was selected. It is a very long presentation. I ask you to hear it patiently with concentration. Additional symptoms seen in the second wave includes pink eyes, conjunctivitis, watery reddish eyes, hearing impairment, GI tracts, vomiting, nausea, diarrhea. All above symptoms have been less frequently seen independently or along with other more common symptoms. Fever pattern. Fever that subsides within 7 days. Persistent fever more than 7 days. Purana Jwara. Fever rise Bhutva Vishama Jwara. Fever with diarrhea, Jwara Disara. These are all the 4 patterns of fever that is seen in the sample size. But treated around 593 cases in total. It was a little long. Program was started long back after, because for getting documents I waited to present. Because we wanted to present a bigger sample size. Headache, anosmia, loss of taste, body ache. We gave Amrudottaram, Patya Kustumbaradi, Darunagaradi, Sudarsana Vadi, Shunti Dhaniga Bhanam were given. They are Kafagara. Indriya Pradoshada Vyadinasana in nature. Anosmia, Drona Pushpi Nasyam, Rashnadi Shirolobam with warm water, which is Vata Kafagara in nature. Applied in the Kapha area, maxillary, frontal, forehead, etc. Pulicharil Cherth apply Jainavarum. Dhumavanam, Rasnadivarti, inhales through nose, exhale through mouth, 4 to 5 days, there were recovery. We asked the patient, give a coffee powder, ask them to smell. If they say they could not smell coffee, then we assess other features and put them for the test. Steam inhalation with ajamodam, pudina, and eucalyptus oil and camphor was intermittently, selectively used. Throat infection gargling was done with warm water. When there is laryngitis, along with Pitta Lakshana, Saptachadadi, Kapha Lakshana, Triphaladi were used. In the Ushna Jalabana, Prananam Avalambanam, it sustains the life, is told. So little by little, it is Deepana, Pachana. Deepana and Pachana are different words. Deepanam can be Snigdha, Pajanam is Ruksha, Hama Pachana, Nala Pachana. Kantya Ganam is there in Charaga, Sodium is not there. Lagu, Amam is Guru, Admanagaram, Anilagaram, Seshmagaram, Navajjaram, it can be given. Kasaswasakaram, Amanasanam, Peenasanasanam, Parshvarujam, pleurisy, Haram. So hot water plays a major role in this disease, which we understood and realized. Temperature, amam, pashimanam, pakvam, you see the graph, hypothermia, hyperthermia. Lot of rasa aushadis were tried based on the availability. Vettu maran, vettu is fits. In febrile fits, it was given. It mimic Ananda Bhairava rasa. In chronic challenging fevers, Jayamangalam, Tribhuvana Kirti were given. Brigat Kasturi Bhairava rasam, Brigat Vaishajya Ratnagar is the reference. Sanjeevani Vadi contains Vatsanavam and Balladagi, Juradisaram, Vishuchika Avastha it is given. We don't give all the medicines to all the patients, but these are all the choices used before I enter into the subject. This is the orientation of availability of drugs that were used in the largest sample. Ayurvedically, it is the largest sample. Chikitsa in persistent fever, Purana Jwaram, Vadapittotare Kafe Mande, Vadapittotare Kafe Mande, Induganda Gridam, Guduji Kshiragashaya. Gridavanam comes first in Jwara, followed by Kshiravana. Both are Madhura Rasa, Madhura Vibhaga, Shida Virya, Guru Snigdha Guna. Gridam is Divana, Kshiram is slightly Virejana. Snegana followed by Shodhana is the protocol. So first Gridavanam followed by Snegana. This is Kshiravana. Vyadi Muktasya Mandagno, Sarpirevadu Divanam. When the patient are tired with medicines, Kshiravana is better. Udara Chikitsa, last word. Purna Chandrodayam, Madhura Rasam, Madhura Vibhagam, Shida Viryam, Snigdha Gunam, Vadapitta Samanam, Swarnam, Hridayavarana Veshanasanam, Kasam, Swasam, Kshayagaram. So that was also given in the tablet form. In eye fever, Padanamridam, Swarnamuktadi Gudiga, Guduchi Sattvam, Shadanga Sudarsanavadi, which contains Bonimbam, is given. In Vishamajwaram, we gave importance to Barangi and Vishnukranti, and we tried in 100 cases. Rasasanduram was added. Swarnamalini Vasantarasam, my guru Dr. B. Vaidyanathan sir, used to give in Vishamajwara, that was used. Juradisaram, the second chapter of Chikitsa of Chakradatta is Juradisaram. Then Raktabittam, any viral disease, there is thrombocytopenia and splenomegaly. And Dad is Dadupagam, cytokine strong. So Ushiradi Kashayam, Panchamrata Parpadi, Vilvari Guliga, Mustapaniyam, Kudadi Arishtam can be given. Now, in Adhisara, you have three protocols. Shodhana, Samana, Stambana. Shodhanam cannot be given. Balam Tasi with Balam. Samanam can be given. Stampanam can be given in Durbala Road. So Ushiradi Kashayam, it is a very famous Kashayam in Darsanam Vaidyasalai, taken from Chakradatta. Stampanam, we have Ashtakshari Gudiga, Gangadhara Churnam, Gudajavadi, Babularishtam, Panchamrata Parpadi. In Shamanam, we have Mustarishtam and Ashtachurnam, Hingoashtaka Churnam. Complications: hypoxemia, acute respiratory distress, hypoventilation, pre-existing ILD due to rheumatoid and ankylosing spondylitis, cardiopulmonary disease. Most common signs: breathlessness, cough, and silent happy hypoxia. Asymptomatic, oxygen comes down. That you will be knowing. Using the pulse oximeter properly was taught to us by our modern counterpart. It was very particular about that. Make sure that you don't have nail paints or henna. Hand should be in normal temperature. Body should be relaxed. It should be seen in index or middle finger. Place the hand over the chest and reduce hand movement. Keep for 1 minute. Record the highest reading that flashes. Oxygen less than 93 needs to be reported to your physician or the center for swift actions. Immediate oxygen elevation was easy, but maintaining that level in the hospital or after physical exertion, either bath or climbing upstairs or going to toilet or going home, the maintaining oxygen level and sudden reduction in doing day-to-day activity was very tough. Sivanaramartham, Swasanandam Gudiga, Swasakasa Chintamani, Rasasanduram were selected in that case. Brigat Kasturi Bhairavarasam was also given. After the stabilization of oxygen, Shavanaprasam, Purna Chandrodayam, Shatfalagradam, Karpuradalam plus Lakshadidalam, which is Urakshada Visheshatvam, has been given for external application once there is no fever. Many patients have residual symptoms of post-COVID infection, fatigue, myalgia, motor weakness, neuralgia, clot and exertion dyspnea with little work. In post-COVID fatigue, based on Agnibala, Ashwagandha, Purna Chandrodayam, Vidaryadikridam, Amrita Prasakridam, Shamana Prasam, Angamarda Prasamana Ganakashayam, Sramagara Ganakashayam were given. These two we tried now only. Previously we were giving for fibromyalgia. Post-COVID myalgia, Bhataradarvadi, Dhanvantara Gudiga, Guduchi Sattvam, Rukshasvedam, Rukshasvedo, Upanagavyo, Valaga, Pudagaistada, Guduchi Sattvam were given. Post-COVID clot prevention, Gomutra Haridegi tablet, Rasonam Garavi Krishna Stira tablet, Trikadu tablet, which are pramadi in nature, which is opposite to abhishanti, were selected and given. Post-COVID neuralgia, post-viral neuralgia, motor neuropathies were admitted in the hospital, where Nadi Kashaya, after Agni Bala, in the Kshaya stage, chronic stage, Vidaryadi, Karpura Dailam and Trilokya Chintamani with ginger juice. Post-COVID exertional dyspnea, Balajirakadi, Nayopayam, Purna Chandrodayam, Dhanvantara Gudiga, Karpura Dailam were given. Patya depends on Agni, Balam. Agni has to be protected. Lagu Agara, Ushna Agara, Ruksha Agara, Anabhishanti Agara, Yavagu with Ardragam, Shundi, Ajamodam, Dhanyagam, boiled vegetable soups, Mudga Yavagu were given. Yavagu and Yusha, a food substance cooked with many articles like legume or pulses, along with liquids is Yusha. Cooked rice is Yavagu. Avoiding Kshira Agaras, Phala Agaras, Idli Dosai were relatively avoided because they are Pulipu. Vaidyanathan sir used to say, Pulipu, 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 Amla, Outpir, Amla Vibhagena. Heavy foods, sour fruits, Amlatvam, Vidahi, it will produce Vidahi, which will increase cytokine storm. Pepper rasam, then ghee, idiyappam is okay. Snana, Varjida, air condition, all these things were avoided. Rest was given sufficiently. Abdominal breathing was thought and advised. Proning in lowered oxygen saturation oxygen saturation less than 94. Now we will go with case studies. Oxygen saturation, 53-year-old male, COVID infection, was already in use of oxygen supply of full capacity initially. Despite of external oxygen supply, the patient was able to maintain SpO2 65-75 only, symptom dyspnea. Here we gave Vipalyasavam, Dhanvantara Kudiga, Sivanar Amradam, Brigat Kasturi Bhairavarasam, Swasananda Kudiga, all mixed together, and 20 drops sublingually every half an hour we gave. There was elevation, but it was not maintained. Exertion reduced the oxygen level. So we have to give other medicines, which I will be telling later. After discharge, after 1 month for these things to become normal. The oxygen, low oxygen saturation. And the lung changes in the CT takes longer time to be normal, but the patient will be functionally normal, dynamically normal. The structural level changes takes time. That is common in many diseases. We have treated COVID fatigue, COVID neuralgia, post-COVID myalgia, post-COVID motor neuropathy, clots, and hypoventilation. Based on the avastha, in our style and curriculum, we change the medicine. We follow Ayurveda, Gunasamprati for everything, and we adopt modern technologies and seek the support of modern doctors. The treatment for asymptomatic and mild cases were given, although many of them were self-limiting. Many Ayurvedic doctors treat these conditions and exaggerate. That has to be avoided. What is the fact? We should tell. There is nothing wrong in telling something is not very much effective. You need to think about another drug. Some of the drug produce adverse reaction. There is no need to get angry, agitated, and tell this drug can never produce adverse reaction, because adverse reaction, hypersensitivity, percentage of error, bad prognosis can come to any physician, any system of medicine at any period of time. So you say Ayurveda is holy, so you don't get adverse effect. It's not correct. We are all scientists, practicing physicians. So we should be open in these issues, because many people whom we are associated were exaggerating. When we were into the real picture, what we saw was different. The real challenge has been to treat and support hypoxic patients where the treatment does not halt at quick recuperation, but also in maintaining the oxygen supply at 95% and above even after being discharged from the hospital, who were closely observed at various stages by our team of doctors. Now we will see some of the yogas, Guna Vikalpa, before I go into the studies. Vyagradi, Kantakari, Shunti, Guduji, Kadudiktarasam, Kafanabandam, Pippali, Prakshepam, Vada Kapajaram, Swasam, Kasam, Penasam, Sarasulam, classical COVID feature. Patya Kustumbaradi, Kustumbara is Dhanyagam, which is the Palashruti resembles URI. Honey and Hingu are the Prakshepas. Prakshepas increases bioavailability, enhances the efficacy of the thing to which it is added. Dalgana says honey is half palam, which we added. Hingu and Masha, which was given separately. Darunagaradi, Tivra Jura, it is given. Very few companies make. This is the potential drugs which needs lot of studies because it was effective. Dasamulam, all the dasamulas are not available. That is the difficulty, negative aspect of the yoga. Pachanamritam, which is called Amrita Ushiradi, which is Pitta Shamanam, Amapajanam in nature. Bala Jiragadi in Vadakasa, it is highly given. Swasakasa, it is given. Abhaya Vipali Muladi. In Vibanda, it is given because it contains Kadagarogini and Shyamaga. It is also Kavajoragara in nature. Saptachadadi Kandusham is used in Pitta Pradhanya conditions. Nadi Kashayam is a Madhura Rasa, Kinjit Kadurasa, Samasidoshna, Vadasamana, Vadanulomana, Tridoshagara, Balya, Amabhajana, Kshatagara. It is given in post-viral motor neuropathies and demyelination in the hospital. Prashamana for fatigue, all are nuts and fruits. Perichamparam, Madalaparam, Attiparam, Ichamparam, barley, navarai, nuts, fruits, cereals. It's very probably a very nourishment Ayurvedic drink you should develop with Sramaharakana. Shramam. Snanam Suraja Sramaharanam. It is told, But both is not applied here. Shadangapaniyam Pittasamanam Sidaviryam Toya Kalpana. It is given when there is Trishna Pitta Pradhanya Lakshanas. Paniyam Vettumaran Kapavadahara. Ananda Bhairavam Kapavadahara. Jayamangalam Tivra Jwara Kapavadahara. Swarnamuktadi Vadi. It also contains a very unique, interesting yoga, which is Tridosha Jwara to do bhavana with Ardraga Swarasa. Vaidya Ratnavali is a very good text. Everybody should have it. It is written by my master. Ashtakshari Gudiga, which contains Agivhenam, Tikta Kadurasam, Kafabitta Shamanam, Agivhenam, produces, blocks the flow of motion immediately. Gangadhara Churnam, Lagu and Brigat, sold by Sarangadhara Samhita, Kashaya Rasam, Stambanam. Panchamrata Parupadi is Adhisaragnagana, Gragani Nasanam. Babularishtam and Aparajita Dhumam. These are all the medicines used interchangeably in various conditions and complications, mild case, moderate case, severe case, kasam, angamardam, neuropathies, clots. These are all the choices of medicine available in front of us. So in mild cases, moderate to severe cases, and in Ubadravas, we were giving these medicines. We are going to see the documentations. COVID-19 management protocol. Patients with greater than 94 need not be admitted. Ask for replication score in RT-PCR. It is called a CT value in the report. It is not the other CT. This is the CT. It indicates how infective that you are to the other people. Score above, generally above 25 is non-infectious. If it crossed 10 days and asymptomatic for 3 consecutive days. Viral replication generally tops by 9th day, which means if you want any benefit of antiviral, it should be given within 9 days. That is why in modern counterpart, there was different opinions came about the use of remdesivir. We know all these things because the modern hospital, there were discussions about this. The RT-PCR CT is, the CT means cycle threshold, not the CT scan. 17 to 24, high viral load. 24 to 35, moderate viral load. More the score, 35, mild viral load. CT chest, less than 8, mild. 9 to 15, moderate. Greater than 15, severe. Parad 1, no. 2, 3, 4, high. 5, very high. 6, very high with PCR positive. RT-PCR may be negative in later cases. So don't forget on clinical issue, radiological issue. Best time to do RT-PCR after the symptom onset, 5th to 8th day, because false negatives are lower in these days. Influence for severity and morbidity and mortality in COVID-19. COVID, SLE, antiphospholipid syndrome, diabetes mellitus type 1, macrophage activation syndrome, hemophagocytic lymphohistiocytosis, all are similar. Frustrated phagocytosis occurs when the antigen cannot be eliminated, leading to the hyperactivation of macrophages and lymphocytes, leading to destruction of tissues. CT changes occur little late. CRP and LDH are very important. Fever, myalgia, exhaustion were very important. This is what we studied from this study. Category 1, COVID positive, oxygen greater than 94, pulse rate less than 24. This is category 1. RT-PCR negative or untested. Symptoms which may suggest COVID: fatigue, myalgia, sore throat, breathlessness, continuous fever, headache, diarrhea, cough, loss of taste and smell. Repeat RT-PCR if negative or not done. Home isolation, screening, outreach camps, home visits. Category 2, oxygen 90 to 94, respiratory rate 24 to 30 per minute, normally 16. Same lakshanas. Repeat RT-PCR, admission in health centers, COVID centers. Category 3, oxygen less than 90, respiratory rate greater than 30. Initiate treatment at hospital facility, refer to medical college, district headquarters hospital, or a COVID center. Our work we have done is approved COVID center. At testing centers, screening, health facilities and outreach camp, case zone management. Pregnant ladies, lactating mother, patients above 65 should be referred to COVID hospitals. Monitoring blood glucose, urine ketones for diabetes, follow the protocols, proning 2 to 4 hours, 4 to 8 times a day. Patients with greater than oxygen 92 in room temperature, room air, for 3 days continuously, they are eligible for discharge with breathing exercise consultation, and ask them to contact you if they develop new symptoms. This was followed. No need to repeat RT-PCR routinely. Surgical masks were advised. Patients on nasal cannula, surgical mask can be worn over it. Simple face mask, NRBM mask. One-way walls prevent exhaled air from re-entering. Surgical mask can worn under them. All healthcare professionals must wear personal protective equipment when caring for COVID patients. Ramjit and Danya were fully protected. They did a wonderful job. They are students of my Gurukulam. They are with me all the time. Guidelines of Ayurvedic practitioners of COVID-19 in home isolation. Ayush has suggested some medicines. They say drink hot water, drink turmeric with milk, drink pudina tea, Shamshamani vadi, Guduchi vadi, Ashwagandha, Guduchi, Pippali, Sudarsanam, Vyoshadi vadi, gargle with Triphala, Yashti Madhu, steam inhalation, Ajamodam, Tulasi, Shunti Dhani Vapanam. These are all respectable. But Ayush would have produced better prophylactic protocols. Agni, Snigdam, Sneham, Kshayam, Snigdam is last. Agni Dibanam, Srodo Sodanam, Snigda Yukta Rasayanam. Like that, they would have promoted. You see, Radha Yakshma Chikisa lungs is affected. Agni Dibanam, Panjagola, Srodo Sodanam, Indivandam Kashayam. Then Snega Yukta Rasayanam, Ajamam Sakritam, Vidharyadi Kritam. Like that, it was told. Randomized controlled trial in the Ayurvedic management of hypoxic patient. Ayurvedic management in hypoxia. 3 groups were divided. One group 30 patients, one fully allopathy, one allopathy with Ayurveda, one Ayurveda alone. For Ayurveda, allopathy conventional examination. Ayurveda all pariksha vidhis. Our boys did that meticulously. Mutant virus and hypoxia. Mutant virus is more infectious, more transmissible, and evade one's immune response. Swasa rodam. Patients develop hypoxemia with or without evident viral phase. Swasam kapavada samanam srodo shodanam anulomanam agnidivanam. Tridiyavarana rasam. Swarnam Vishakaram has been given. So in the modern hospital setup, we cannot change the medicine based on avastha. Ayurvedically we were doing. Here we did a group of medicines which work on prana samrakshana. Swasakasa Chintamani, Mahalakshmi Vilasam, Kasturi Guliga, Tuduvadai, Vyagradi Churnam, Karpura Delam, chest application if there is no fever. This is what our boys were giving. We have previous studies, a lot of references available. Ram Manoharji has also done a study. Mahaswasam, Urdhva Swasam, Chinna Swasam, Tamaka Swasam. I have talked elaborately in my first talk on the day 1 on Wednesday. Causes of hypoxemia, intrapulmonary shunting, loss of lung perfusion, intravascular thrombi, impaired diffusion capacity. Research question. Will concomitant Ayurvedic treatment with allopathy in hypoxic COVID patient be effective? 85 to 92, 93. Aim to evaluate the efficacy of concomitant Ayurvedic treatment with allopathy in hypoxic COVID patients. Objective to evaluate the efficacy of concomitant Ayurvedic treatment with allopathy in hypoxic patient. Null hypothesis. The treatment protocol is not effective. Alternative, the protocol is effective. Methodology, trial design, description of the type, design control, design of the trial to be conducted, randomized control trial, pre-investigation, post-investigation, review done on every day while admission and after discharge, review will be done on 15 days. Assessment done on the day of hypoxemia and at the time of discharge. Measures to minimize or avoid bias. Patients with COVID positive reports with hypoxia 85, starting from 85. With either gender, irrespective of the age, admitted in Vasantham Healthcare Center, approved Corona Center, taken into the studies. Subjects will be enrolled for the study after necessary investigation from recognized laboratory, dose fixed as per the classics. Inclusion criteria, were considered. Ayurveda with allopathy was given for 30 cases. Follow-up review will be done after 15 days from the time of discharge. Vagri Churnam, Vagri. Discontinuation criteria, unwillingness of the subject to continue treatment, adverse drug reaction. Group A, Ayurveda and allopathy 30, allopathy 30, Ayurveda 30. Setting, intensive care unit, Vasantan Center, Dr. Y. Mahadev, Sri Sarada Ayurvedic Hospital, mild to moderate OPD basis. Sex irrespective, 30 number each group. Oxygen saturation criteria fixed. Sampling procedure based on inclusion criteria until the sample size is achieved. Inclusion criteria irrespective of the age, tested positive COVID-19, oxygen saturation 85 to 95, subjects willing to sign the consent form. மருத்துவ ஒப்புதல் படிவம் எனும் வயதாகிய நான் இந்த முகவரியில் வசித்து வருகிறேன். இந்த படிவத்தின் மூலம் நான் கொடுக்கும் ஒப்புதல் என்னவென்றால், COVID-19 உடலில் பிராணவாயு குறைந்த நிலைக்கான ஆராய்ச்சி நெறிமுறை மருத்துவ பரிசோதனைக்கான ஆய்வுக்கு என்னை உட்படுத்துகிறேன் எனும் அனுமதியை இதன் மூலம் வழங்குகிறேன். இதற்கு எனக்கு செய்யப்படும் குறித்து சிகிச்சைகள் குறித்து மருத்துவர்களால் நன்கு விளக்கம் அளிக்கப்பட்டுள்ளன. இந்த சிகிச்சையின் விவரம் பற்றி எனக்கு எந்த சந்தேகமும் இல்லை. சிகிச்சையின் பொழுது குறிப்பிடப்பட்ட காரணங்கள் இல்லாமல் கூட சிகிச்சையை நிறுத்த எனக்கு சுதந்திரம் உள்ளது என்று நான் உணர்கிறேன். சிகிச்சையின் போது ஏதேனும் அசௌகரியம் ஏற்பட்டால் நான் யாரை தொடர்பு கொள்ள வேண்டும் என்பதையும் மருத்துவரால் எனக்கு தொடர்பு கொள்ளப்பட்டது என்று தெரிவிக்கப்பட்டு, பெயர், சாட்சி, மருத்துவரின் பெயர், தேதி, இடம் உறுதி செய்யப்பட்டு கையொப்பம் வாங்கப்பட்டது. Consent form in modern, the patient, the age, resident give the consent for the treatment. Procedures were explained. They accept that. They can stop it anytime. Freedom were given to them. Witness were signed. Inclusion criteria were selected. Exclusion with COPD, ILD, 84 below, pregnant ladies were exclusion. Unwillingness to participate, adverse drug reaction, emergency when oxygen falls below 70. Of course, we have treated few cases of 70, 74, which I will tell one or two cases independently I will present. Subjects will be replaced by any participant discontinues during the treatment period. The replaced subject will have to satisfy inclusion criteria. Follow-up subjects withdrawn will be done as required. Chintamani, Vaishya Ratnavali, Hikka, Rasendra Bagri, Rajanigandu, Karpuradayalam, Sakasrayogam, Swasta Chintamani 111, Mahalakshmi 111, Bagri 1 teaspoon BD, Kasturi 333, Karpuram external application, powders, tablets, oral, oil external, oxygen saturation up to 95 at room temperature. Until then, treatment was given. Medication and treatment permitted, including rescue medication. Medication and treatment permitted, including rescue medication, are not permitted before and during the trial. Routine essential medicines were permitted, like antibiotics, steroids, anticoagulants, antihistamines, antiviral, from our allopathy counter for the 30 allopathic patients. Additional supportive medicines were decided by the doctor. Assessment efficacy, subjective parameters, fever, dyspnea, cough, tiredness, body pain, assessed. CT involvement score assessed. Severity score assessed. Less than 5% involvement, 5 to 25, 26 to 49, 50 to 75, 75. Total CT score is the sum of the individual lobar score that can range from 0 to 25. When all the 5 lobes show more than 75% improvement, 0% right lower lobe, 1% less than 5%. Category CT score 2, 5 to 25, 3, 26 to 50, 4, 51 to 75, 5 greater than 75. Specification of safety parameters. In emergency, medicines discontinued and managed accordingly. Methods and timing of assessment, record analysis and safety parameters. They are monitored, recorded 24 hours constantly. They are monitored through phone calls after 50 days of discharge. Adverse reactions were monitored during and after the discharge. Type and duration of follow-up of adverse event. Adverse event did not occur. LFT did not change, RFT did not change, total count did not change. So the toxicity of renal toxicity, hepatobiliary toxicity, changes in the count, changes in the count, little change happened. Liver and kidney, definitely in spite of Rasaushadhas, it didn't happen. Data were collected through a case record form. Medicines were purchased from GMP certified company. Some medicines were prepared references. Case record from age, sex, religion, occupation, as lung disease, allergies, processing disease were posted. Medications were noted. Family history, appetite, nature of diet, bowel habits, stool consistency, urine output, addiction, smoking, alcohol, sleep, stress, appearance, build, height, respiratory rate, BP, rhythm, character of the arterial wall, temperature, oxygen saturation. Day 1, fever, cough. There was a grading score for cough, grading score for dyspnea, grading score for tiredness, grading score for body ache. Day 2, day 3, day 4, day 5, day 6, day 7, day 8. Like that it was continued. Already we told the tests were taken before and after. Before and after, cough, dyspnea, tiredness, body ache were assessed. Dry cough, no cough is grade 0. 1 to 2 bouts in a day is grade 1. More than 3 is grade 2. Continuous at night, grade 3. Continuous at day, grade 4. Cannot speak because 5. Likewise, grading for dyspnea, grading for tiredness, grading for body ache were methodologically done and meticulously recorded. Anaksha, Ayurveda, of course, we did so many things, but dosha, avastha, agni, ama, nidra, sattvavala, koshta are given importance. Wait, kindly wait. So, Ayurvedic study in hypoxic patient. COVID death, 60 years and above, 50%, 46 and 60, 35%, 30 and 45, 11.4%, 15 and 30, 2.5%, less than 15.5%. Diabetes, 27.85, 80%, hypertension, 22%, respiratory, 13%, cardiac ailment, 6%, pre-existing disorders and COVID death. Diabetes, hypertension, cardiovascular, 2.8%, kidney, 2.2%, liver, 2.8%. Comorbidities. Available data suggests 70% of the cases affected with COVID exhibit mild symptoms. They need not need admission. 30% moderate to severe cases are challenging. They need admission. They have comorbidities mostly. Common causes of death: pneumonia, ARDS, embolism, sepsis, sepsis shock, multi-organ failure, bacterial infection, fungal infection, cardiovascular failure. COVID hypoxia, very challenging complication. Causes of hypoxia: intrapulmonary shunting, intravascular thrombi, loss of lung perfusion regulation, impaired diffusion capacity. Diagnostics too. Repeated investigations were required. It was expensive. Some good-hearted people supported the whole project. So whole project was done free of cost. Repeated radiological testing is carcinogenic. We were careful about that. The neutrophil to lymphocyte ratio value greater than 5 was a boundary value worth of reference, because more than 80% of the severe patients had an NLR value greater than 5, and over 80% of non-severe patients had an NLR value less than 5. Very, very important simple test. Neutrophil count elevated. Interleukin 6, accurate inflammatory marker. Other tests, of course, we did. Cytokine strong. See how beautifully my slides are prepared by Saju and Aishwarya and Jaya. We have a team, wonderful team. Hypoxemia, Ayurvedic pathogenesis, Vata fluid in alveoli, Drava pravritti, Kapha Drushti, release of excess neutrophil, extracellular trap, Thanam, Pranavaga Srodhas, Moolam, Hridayam, Mahasrodhas. Adipravarti, Vimarga Gamanam, cytokine storm, Sangam, caused by alveoli filled with fluids, Sira Grandi, intravascular emboli. This is the idea of my Shishya, Dr. Aishwarya. So the credit goes to that. Ayurveda Chikitsa, COVID-19, hypoxemia, Amavastha, Avaranavastha, Vyavahi, Vikasi, Pranavaga Srodhas, COVID and Visham, Vyavahi, Vikasi, Sukshmam, Yogavahi, Shikra Gadirgadi, Pranaharam, all are there. So Swarnam was selected, Swarna based medicines were selected. We will present two cases. Standalone Ayurvedic treatment in COVID hypoxemia, integrated Ayurveda and allopathic treatment in COVID hypoxemia in an allopathic setup. Name, patient name, age, standalone Ayurveda, known illness. Oxygen 98, 97, 97, 94, 91. COVID hypoxemia. Breathlessness. You see this? Fatigue, cold, fever, cough. This is the order of manifestation. Breathlessness, persisting breathlessness, oxygen came down. Fatigue, cold, Barangyadi, Sudarsanam, Vyoshadi Vadagam. Fatigue, cold, Barangyadi, Vetumaran, Vyoshadi Vadagam. Fatigue, fever, Barangyadi, Sudarsanam, Vyoshadi Vadagam. Oxygen 94. Breathlessness, Mahalakshmi Vilasarasam, Kasturi Gudiga, Vyoshadi Vadagam. Severe cough, breathless on rest, Mahalakshmi, Vyagradi Kashayam, Swasanandam Gudiga. Cough reduced, breathlessness persist, oxygen 89%, Mahalakshmi, Kasturi, Vyagradi, Swasanandam. The patients recovered very well when they were discharged. Vidaryadi Purna Chandrodayam were given. Karpuradayalam application was given. You see this neutrophil is 89. COVID was positive, then COVID became negative, then CT scan. CT scan, can you project it? The report. And the previous one. Okay. Focal ground class opacity is pneumonia involvement 4%, less than 4%. Here, multifocal area of ground class opacities being predominantly on the peripheral lower lobe. Score 9/40. So what we understood, there was improvement subjectively, but the CT changes, but patient was normal, oxygen was normal. It takes fibrosis to recover long phase, even 2 months, even on oxygen concentrator in the Ayurveda alone treatment. Rasayanas, giving rasayanas and patyas, subjectively okay. Even little exertion maintained the oxygen. But the fibrosis change in the CT, better not to take CT in the short phase, because slightly increase of score was observed. This is the fact. I am telling the fact. Other parameters, there were difference. All interleukins, everything came down, but ferritin did not come down. Standalone Ayurveda Chikitsa in second case, COVID-19 hypoxia, COVID with diabetes, fever, myalgia, anosmia, all these features. Oxygen 98, 96, 78, 74. It went respiratory rate, it went up to 30. Then it became 95 in the last date after the treatment. Darunagaradi was given for fever. Suryaprava Darunagaradi for myalgia. Rasnadi Dhumavarti for anosmia. Then fatigue. Darunagaradi was given. Breathlessness, Nayobayam, Pipalyasamam, Sivanaramadam, Brigat Kasturi Bhairavasam, Swasanandam combination was given. Oxygen 80. Oxygen 78, same continue, 85, 92, 92, 92, 95, 95 was maintained, then discharge. Ayobhaya, Purna Chandra, Ashwagandha Churna, Vidaryadi Gridam, Rasamula Rasayana. 86, lymphocytes 8. There was a case. They went to Western Hospital. Was there for some days. Oxygen did not improve. Around 91, 92 discharge. We treated her. So we got a testimony. My name is Dash. I am currently residing in Tirunelveli. My email is that. Recently I returned from USA. I was down with COVID from April 26 and hospitalized for the treatment. My oxygen saturation level was 65 to 75. even with oxygen concentrated. During this time, doing simple like small walk around the bedroom or going to bathroom caused breathlessness and dropped my oxygen saturation. During the time we were on medicines given by myself and my team, I have to say the level of care and treatment is phenomenal and personalized to what the individual needs. Dr. Madhavan and his team not only answered all the questions, they proactively followed checking with my wife. Treatment, I am able to maintain saturation around 95. Now I am able to climb stairs and able to play with boys. They ensured we received medicines. He looked towards future health, that is preventing complications. I sincerely thanking this life-saving team and a special thanks to Madhavan. We got a lot of letters from all over the world where we sent online consultation. This was a very serious case. It responded well. But I have failures also. Not all the cases were successful. Some cases were successful. Many cases I had failures. So total number of patients treated in allopathy, Ayurveda, integrated 30. Recovery 29. Number of patients died 1. Number of patients on O2 concentrated post-discharge 2. COVID antibody post-infection 10/30. Maximum number of hospitalization 16. Post-COVID fatigue 10/30. Post-COVID complications 1. Number of patients in O2 support during hospitalization 30. Age 30 to 75. Study of allopathy COVID center and integrated approach ESR. Squamous cell carcinoma patient with COVID, prostatomegaly, inguinal hernia, hepatomegaly, fever, vomiting, admitted. Oxygen 87, 95, 95, 95, 92, 95, 96. The patient was allowed to use oxygen concentrated whenever there is breathlessness or reduced to SpO2 at home. Mahalakshmi, Swasananda, Swasakasa Chintamani, Kasturi, Asarishta, hot water fermentation bag were given. Advised rest after the 15 days until the review. Use of O2 concentrated 1 hour exertion. Advised to continue allopathic medicines. To continue Ayurvedic medicines, take home Purna Chandarodayam, Vidaryadi, Dasamula Rasayanai, Proning. Interleukin was 2049, then it became 39.83. The inflammation, Dhatu Paka Avastha, reduced. Another case, hemiparesis, diabetes, corona. Oxygen reduced. Fatigue was the feature. Sivanaramadam, Swasananda Sindhamani, Yoshadi Gudiga were given. Avastha Visesha Chikisa was given. Take home Aswagandha, Purnachandra, Daya, Vidaryadi Gradam were given. Total score 15 for 25 before. Score 19 for 14. The score increased. The score decreased.
62.
From it was 60, then it came to 47. COVID pneumonia. Last case was increased, sorry. 62 total lung involvement. COVID-19 is a disease that quickly progresses and leads to fatality. We need to use oxygen concentrated most of the times. In standalone Ayurveda treatment also, assessment made 2 days to understand the severe of the disease. Ayurvedic medicines help raising oxygen, but physical strain can drop them. steeply. Utmost care must be taken, and a sustained treatment for longer period is a must. COVID hypoxia is managed with integrated allopathy and Ayurveda management. Post-COVID complications made it difficult to complete recovery after discharge from hospitalization. Complete recovery takes 3 months in the cases we have seen with fibrosis. Ayurvedic failures also. We cannot say Ayurveda. Everybody is learning. Modern medicine is learning. This is new to me. I was learning. My students were learning. I asked my gurus. They were learning. Quick and sudden rise of oxygen cannot be considered as a victory because our medicines increased. That was not victory because a sustained maintenance is a challenge. We treated 560 cases, 52 cases COVID hypoxia. Ayurveda cannot be tagged as an alternative care or hypoxemia, but can be tagged as a supportive care to COVID hypoxemia from the experience. This is my personal opinion. Absolutely personal opinion. More successful integrated approaches. Kindly wait. Now, post-COVID stroke. I am going to show you post-COVID stroke. Stroke, 23% of the COVID patients have stroke. COVID patients have a prothrombotic state. Clot can be formed. It is not clear, but a part of it's due lack of oxygen in the brain. Clotting formation, heightened immune response, direct invasion by the virus in the brain. Stroke has been reported frequently to Darsanangop Hospital. We checked the CT, RT-PCR negative, CT symptoms were there. Ferritin was high, interleukin was high. Hemorrhagic stroke was seen. Central venous sinus thrombosis seen. Here, they don't have sugar, pressure, smoking, alcohol, obesity, atrial fibrillation, vasculitis, ANA negative, homocystinemia. All these things were checked after COVID. So they were labeled as post-COVID stroke. So came with headache, right hemiplegia, 1 month, high-grade fever, urine intact. After steroids, they developed diabetes, no hypertension, nothing significant. BP 150, 100, stress, then repeated checking, it was not there. Higher mental functions normal. Cranial nerves, UMN facial palsy. No dysarthria, dysphonia, dysphagia. Power 0. Supinator absent. Plantar extensor in the affected site. No incontinence. Sensory hyperesthesia absent. Motor weakness. Sensory intact. No meningeal irritation. No vasovagal attacks. Complete blood counts were tested. Ferritin was high. You see, ferritin was high. LDH was high. Interleukins was very high, but RT-PCR negative. Sinus bradycardia. Interleukins, high creatinine. Urea creatinine were borderline high. So this is the massive infarct in the temporoparietal region. When they came to the hospital, large patchy subacute infarct in the frontal lobe involving the left caudate nucleus. Then chest CT, chest X-ray was, we started afresh. Doing all the things. Ferritin was very high. Pre-bronchial. It showed T2 flare hyperintense signal in the left capsuloganglionic region, post-frontal parietal, showing mild diffusion, restriction, and gyriform enhancement. You see this infarct here, huge infarct. T2 and flare hyperintense signals in left internal capsule ganglion, post-frontal parietal lobe, showing diffusion restriction, gyriform enhancement, and subacute infarct. Non-visualization of left internal carotid artery. Here, infarction, kapavadagara chikitsa, udvartana, mridu, snigdayukta virejana, vasti, nasyam, ashtavargam, antaravastadi, rasonadi, krambuchurnam, sitta, पूनागदैलम अश्वगंधारिष्टम कोरगुलत्तादि तलम अभ्यंगम जंबीरबिंडस्वेदम सर्व अनिलाभगम परम द्विपंचमूलादिवस्ति शिरोवस्ति नस्यम. After treatment, ferritin was still high. You can see the resolution of infarction. Interleukin 48, 6, CRP 68, 4, LDH 295, 122. Ferritin increased. Ferritin didn't come down. That means the inflammatory process is there. This is previous, this is later. You see the glyosed tissue. Compared with the previous MRI, the person can show reduction in the volume of infarct with the perfusion hemorrhage with the MRI angiogram shows non-visualization of left ICA occlusion, left ACA and MCA filling through ACOM, right ICA, ACA, MCA normal, both PCA normal. After the treatment, no evidence of flow in the left internal carotid artery, reformation of left ACA and MCA by collateral circulation. However, they appeared reduced in caliber. T2 flare hyperintense signal in left ganglionic region. Compared to previous MRI, present scan shows reduction in volume of infarct with reperfusion of hemorrhage within. That means there is improvement. Was brought and he walked. All the cases of COVID stroke showed very good improvement. Power 0 came, leg became power 3+, hand 2+, circumduction gait. He improved a lot. Right side stroke, speech came, mild dysarthria was there. Now next case. It's a very interesting case, lymphoma. COVID symptoms were there. We assessed. COVID was positive. We find the nodes in the axilla. We screened MR mammogram to rule out for primary. WBC was 85,000. So we treated the COVID. After treating the COVID, we treated non-Hodgkin's lymphoma. And how did we conclude to this thing? It was a diagnosis in the Resenenbo. Autoimmune disease, lymphocytes are the part of immune system, and the enlarged lymph node, fatigue, weight loss, shortness of breath, loss of appetite, neck sweat, recurrent cough, dyspnea, postnasal breathing difficulty, oxygen was less, lymphadenopathy around axilla. Oxygen saturation 90. Temperature was there. Lymphocytes 88. Hemoglobin 11. Interleukin 61. CRP 54. Platelet normal. Blood smear chronic lymphoid leukemia. RT-PCR positive. Peripheral smear. Can you project this? Chronic lymphoid leukemia.
Screen.
Chronic lymphoid leukemia is there in the peripheral smear. So C-reactive protein high, interleukins high. COVID was treated first. CT chest was taken, pneumonia, and we got the lymph nodes. So we wanted to do the primary. We were investigating. That is not available easily in this area. Cardiomegaly, pericardial infusion, axillary lymph nodes, all these things were there. COVID pneumonia was treated. Axillary, we were treating COVID first. Hepatomegaly, splenomegaly, all were there. After treating the COVID for this lymphoma, we correlated with Rasadushti, Kapadushti, Rasavagasrododushti, Kapagara Aushada Chikissa, Pasa Kuduchi Adi, touching Raktabittam Pandu, Arbudanasana Aushadas were selected. First Patya Kustumbradi, Sudasanam, Lakshmi Vilasam, Pippali Rasayanam. COVID phase was cleared, very easily cleared. Oxygen was 90 only. Satya Kustumbradi, Vasa Kuduchadi, Mandura Vadagam, Mritvigadi, Kuduchi Sattvam were given in the second phase. The WBC from 85,000 became 60. Lymphocyte became 45. We have got records. You see this. WBC was 85,000 and it became 45,000 here. And the patient is doing extremely well. Lymphocytes 80 from another lab. Flow cytometry was advised. Scan was taken. Mild COVID pneumonia severity 10.5 for 40 with lung involvement 27%. That part was cleared. Mediastinal lymphadenopathy. So dyspnea, post-nasal drip, shivering with fever, loss of appetite, nausea, amapachana, tittarasa, kadarasa, jorakadra, chikissa were adopted. So oxygen from 90 became 97. Then Shofakana, Pandavakana, Rasavagasrodo, Dushti, Aushadas were given for Hopkins lymphoma. Interleukin 61 to 54 to 2, 452 ferritin to 54, ESR 99 to 15, WBC 82,000 to 42,000, lymphocyte 88% to 83%. There is remarkable improvement. My dear friends, with that, I conclude the talk. I have not done anything special. It's all my students. Danya, Ramjit, Aishwarya's contribution, her style of writing, Jayalakshmi's committed, focused clinical attention, her Ayurvedic knowledge and in-depth modern knowledge, and the ability to communicate with modern doctors, and many institutions. There are bigger institutions. We are a very small. You see, I wanted to put the photograph of our hospital. It's a very small old building which is looking to collapse. But we did color atlas of venereology, color atlas of Pushtam, 16,000 pages we printed, 40,000 cases we treat, 16 students are with me. Today also we diagnosed IgA nephropathy. Top students, I am surrounded by students, all are students. I am able to do everything because I have Saju with me. Those who know Mahadevan know more about Saju. The கடன் வாழ்க்கையில நான் பட்ட கடன் என் குருநாதர் வைத்தியநாதனுக்கு அதை நான் ஒரு விதம் அடைச்சிட்டேன். சஜுவனுடைய கடன் அடைக்கிறது கஷ்டம். அடைக்கவே முடியாத கடன் என்னுடைய குருநாதர் ஞானானந்தகிரி சுவாமிகள், மடப்புறம் தட்சிணாமூர்த்தி சுவாமிகள், அவர்கள் சித்தர்கள், தன்னை உணர்ந்தவர்கள், சங்கல்ப மாத்திரத்தில் நோயை குணமாக்கும் தன்மை உடையவர்கள், மகாத்மாக்கள். அந்த பூஜை புனஸ்காரங்கள்லாம் பண்ண முடியாதவனுக்கு உள்ள ஒரு தூக்கி விடுற வழிதான் குருவனுடைய பாதுகை. அந்த குரு பாதுகையை நான் வணங்குறேன். என் குருநாதர் வைத்தியநாதன் சார் அவருடன் வாழ்ந்த காலங்கள் 20 வருடம் ஆகிவிட்டது. ஞானானந்த சுவாமிக்கும் மடப்புறம் தட்சிணாமூர்த்தி சுவாமிக்கும் நமோ நமோ ஸ்ரீ குரு பாதுகாப்பியாம் என்ற வணக்கத்தை சொல்லி, என் பேர் அளவு கடந்த அன்பு வைத்திருக்கின்ற என்னை நேசிக்கின்ற இளஞ்செழியன் சாருக்கும், ஐ ஆஸ்க் குடும்பத்தாருக்கும், இமானுவேல் அரசர் அனைத்து பணியாளர்களுக்கும், என் அன்புள்ள குழந்தை ஹேமா சுபாஷினிக்கும், என் சிஷ்ய சம்பத்துக்கும் பகவான் எனக்கு கொடுத்த அளவுக்கு சிஷ்யா இன்னொரு குரு ஆயிரம் 10,000 விக்டரி இஸ் ரிட்டன் யுவர் ஃபோர்ஹெட். இதுதான் வைத்தியநாதன் சார் சாகரத்துக்கு முன்னாடி கிட்ட பேசின வார்த்தை. அது நினைவாச்சு. அந்த மகான் தந்த அறிவையும் உணவையும் நினைத்து பார்த்து கொண்டு எனக்கு வாழ்வழித்த தாத்தாவுக்கு நன்றி சொல்லி உங்கள் அனைவரையும் கரம் கூப்பி சிறந்தார்த்தி வணங்குகிறேன். எல்லா மருத்துவமும் ஒண்ணுதான். யாரையும் குறைஜோரி பேசக்கூடாது. இருக்கிற நல்லதையும் எடுத்துக்கணும். எல்லாரையும் வணங்கணும். வினயமா இருக்கணும். அடுத்த ஐ ஆஸ்க் கிளாஸ் எல்லாம் முடிஞ்சது. நீ தமிழ் மருத்துவ தொன்மை, தமிழ் மருத்துவ உணவுகள்லாம் பேச வேண்டியிருக்கு. சகசிரயோகம் கண்டினியூ பண்ண வேண்டியிருக்கு. இளஞ்செழியன் சார் ஆசீர்வாதம் பண்ணணும். நமஸ்காரம். ஹேமா சுபாஷினி நடத்தி தரணும். Yeah. Few questions.